Good morning, my name is Wayne Derrick and I'm a third year exercise physiology student, and today I'll be performing the one-leg stance test on a 65-year-old pensioner who is recovering from a hemiplegic stroke of the right side. Hemiplegia is paralysis of one side of the body which is often caused by a stroke. There are two main types of strokes: ischemic, which is a lack of blood flow to the brain caused by blockages in the arterioles, or hemorrhagic, which is caused by bleeding on the brain from lesions. Adequate balance is necessary to maintain static posture and stabilise the body for daily activities such as gait, stair climbing, turning and getting dressed. The one-leg stance test will be used to assess the client's ability to balance, muscular strength of the hip and leg, and the potential risk of falling. The test will be performed 3 times on each leg for both the eyes open and eyes closed test, with a 30-second rest period in between testing. Hi Alex, good to see you again.
Good to see you.
How are you?
Good, thank you.
Okay, have a seat. Alright, so as we discussed last week, today we're going to be performing the one-leg stance test. The reason why we're doing this is to assess your balance and muscular strength due to the hemiplegic stroke you suffered a few months ago. As standing on one leg requires an appropriate level of static balance, hip and leg strength, as well as the integration of the central and peripheral nervous system. Any weaknesses in these areas can increase your risk of falling. From your ability to perform these tests, I'll be able to identify these weaknesses and prescribe you an exercise program to improve your muscular strength and balance, therefore reducing your risk of falling. So the one-leg stance test is a relatively easy test to do, and I'll just briefly outline the testing procedure before we get started. So I'll get you to firstly remove your shoes and then stand over by the bed for support, just in case you lose your balance throughout the test. I'll get you to put your hands over your chest like this, lift one leg off the floor and hold it as close to but not touching your standing leg. Hold that test position while looking straight ahead, focusing your glance, and hold that position for as long as possible. We'll perform that test 3 times on each leg for the eyes open test, and 3 times on each leg for the eyes closed test. Time will commence when your foot leaves the floor, and time will cease as soon as 45 seconds is recorded. Time will also come to an end if your hands move away from your chest, your foot touches the floor, or moves away or to your standing leg, or your standing leg moves to maintain balance. So there is a risk that you may fall during this test, but I'll be standing beside you for support to prevent that. And if you feel any discomfort or pain throughout the test, let me know immediately and we'll stop testing. So do you have any questions?
No questions.
Are you happy to proceed?
Yes.
Okay, good.
Cool.
Okay Alex, so we're going to begin with the open-eyed test. We're going to move over to your impaired side now. Okay, so just put your hands on your chest, and when I say go, I'll start timing and you can lift your foot from the floor. Okay, go. Good, well done. Good. And excellent, well done. Alright, so okay, Alex, so now we're going to move on to the closed eyes test. And hands on your chest, and when I say go, lift your foot off the floor, and I'm standing beside you for support just in case you lose your balance. Okay, and go. Well done. Okay, so from the results recorded today, Alex, the best time and average times from each of the eyes open and eyes closed test are taken and compared to the normative data for each age group. The normative data for the 60 to 69-year-old group for the eyes open test is 33.8 seconds for the best time and 28.7 seconds for the average time. Your times were 20 seconds for your best time and 19 seconds was the average time. And for the eyes closed test, The best time for the normative data is 5.1 seconds and 3.1 seconds for the average time, and your times were 3 seconds for your best time and 1.5 seconds for the average time. So in comparison with the normative data, your times were significantly lower, indicating that you are at a higher risk of falling. So what we need to do is prescribe you an exercise program that has a combination of both strength and neuromotor exercises to improve your balance, therefore reducing your falls risk in the future.